I think like you, going through my illness, no one was jumping up and down saying, this is a horrible thing. We're going to figure it out. Why wasn't it an emergency? And to be brushed off of maybe it's just an anxious female, or are you depressed? Maybe it's your hormone. I'm completely disabled. But to not be validated for that level of suffering that you go through, at least when I figured things out, and it was a long process, many steps, the validation of getting the patents, and the patent board attorneys are extraordinarily smart, that helped. It gave me validation where my doctors couldn't.
Hi, and welcome to Don't Drink to Feed podcast. This podcast is all about you and all the courageous, driven women like you. We are here to inspire, to empower, to share, and to embrace one another. We will be talking with women from different backgrounds and careers about love, family, friendship, their wins and falls, and what it took for them to live the life they love. I am your host, Claudia Noriega-Bernstein, and I am so happy you're here today. Hi, everyone. I want to welcome Dr. Diana Driscoll. She's one of the few medical authorities specializing in the autonomic nervous system, particularly its role in invisible conditions that disproportionately affect women. We're going to talk about her and also her journey. But first, I would like you, Diana, to share a little more about how this journey has been for you and why you got really curious about your own health.
Yes, well, first, thank you for having me, Claudia. It really is an honor to be here. I think my journey was just horrible and it was long, and anybody going through some sort of journey, I really want them to have hope and know that there's reasons for illness and do not give up. But I was basically thrown into this. The autonomic nervous system is part of the nervous system nobody likes to think about because it's something we shouldn't have to think about. It works all by itself, digestion, tear production, slowing your heart rate, that sort of thing. But when that goes wrong, which is what happened to me after I got a virus, the whole body can be affected and no one could figure it out. I was completely disabled. I had to stop practicing optometry that day. I couldn't see my last 2 patients and went to probably 50 doctors, thinking it's such a dramatic illness. I just haven't gotten to the right doctor yet to figure this out, right? And as it turns out, there were no answers for it. And so I got thrown in having to figure it out on my own.
That is so crazy because we were talking before we started recording, and that's similar, of course, not as severe as you, but that's similar what had happened to me. And I started with fatigue. I was just super tired. I didn't know what was wrong. My stomach was bothering me. So first was, let's take your gallbladder. And then you probably need IVs with B12 and then this and then that. So what I was telling you, I went from a regular doctor to a homeopathic doctor to a homeopathic regular doctor to anything that could give me some answers. And they still don't know what's wrong with me. I mean, the only thing that they ever have diagnosed really was pernicious anemia and the cancers that I had, but everything else is a great area. So my last diagnosed was lupus, and I was like, oh my gosh, I have lupus. I had to have a conversation with my kids because they lost their dad 5 years ago. So now how are we going to navigate this? Then I went back to a specialist. She said, looks like you had a spike because your diagnosis now doesn't look like a positive. So I'm like, okay, what does that mean? Well, maybe you have rheumatoid arthritis, so we're going to put you in this medication. And I'm like, when does this end? When do you get the answer? And what you were saying before, oftentimes we feel not seen. And it's like, am I crazy? Am I making up these symptoms? What is going on?
You're definitely not going crazy. I know my symptoms initially were fairly vague, and they would multiply and change all the time. At one point, I pulled out my spreadsheet of symptoms that I had. I had 80 symptoms, Claudia, and they were shifting all the time. And I remember one of the doctors saying, there's no way that an illness can affect every system of the body. Well, there was a way, but it did have to be peeled back. Ultimately, my diagnosis was POTS, postural orthostatic tachycardia syndrome, which I remember celebrating that. We have an answer. There's going to be a treatment protocol. They'll know what's going on. It was a complete dead end. because that is not a disease. It's
Right.
presentation. Something else was driving it, and no one, not even researchers, I was in clinical trials for it. Even the researchers were not able to locate, and perhaps not interested in locating the underlying process causing all these dominoes to fall. And ultimately, a few years into the illness, when the researchers told me, well, we think POTS patients are perfectly normal. They're just more aware of their own bodies. I
Right.
realized I was on my own. And I set up genetic disease investigators to house research. I thought if anybody has a chance, I have a medical background. I'm in the body of a patient. I have children ultimately who became sick too. We're very highly motivated. Let's see what we can figure out. And no, it has a happy ending. I'm perfectly fine. My kids are perfectly fine. We've had POTS care over 10 years now, and I have currently 5 patents on this.
I think it's brilliant that you went that route because it took you so long to figure
Oh,
out that you deserve the credit and the recognition of finding these things and have your name attached to it.
yeah, it was very validating too. I think, like you, going through my illness, no one was jumping up and down saying, this is a horrible thing. We're going to figure it out.
Mm.
Why wasn't it an emergency? And to be brushed off of maybe it's just an anxious female, or are you depressed? Maybe it's your hormones, and I'm completely disabled. But to not be validated for that level of suffering that you go through, at least when I figured things out, and it was a long process, many steps, the validation of getting the patents, and the patent board attorneys are extraordinarily smart. That helped. It gave me validation where my doctors couldn't. And then ultimately, I thought the validation I'll have to depend upon is recovery of myself and my children. And that'll be enough validation. And then ultimately, helping patients at POTS Care was very validating. But those many years of doctors not understanding, and even friends, they try to hang in there, but in a chronic situation they start to fall off,
Right.
especially when the doctors say we can't find anything wrong, everything looks good.
Right. So that is like saying you're wrong. What you
Yeah,
see, what you're feeling is in your head. Get over
that's right.
it. You're fine. And then you go home and you're like, wait a minute, but my legs are hurting or my head is hurting. Or you were talking about the postural orthostatic. That is
Mhm.
also an illness that is very hard to diagnose and is mainly with women, correct?
That's correct. And unfortunately, it's not truly an illness, it's a presentation. It's like fever isn't an illness, it's a
Hmm.
presentation. Something's causing the fever. In POTS, the patient gets vertical and their heart starts to race.
Right.
Something is making that happen. So the patient's true diagnosis should be whatever's driving that change, right?
Instead of the
That's
symptom.
exactly, not the presentation. And you tell a doctor POTS, they think, oh, tachycardia. Oh, that's a heart problem. And they send you
Right.
to a cardiologist, and the cardiologist go, well, your heart's okay. I don't know what to do
Right.
with this. And the patients don't have any place to go that's effective. The traditional treatment for it is
Hmm.
to treat it as if it's like dehydration, which makes no sense at all. Doesn't help the patients. In fact, oftentimes harms them. So trying to figure things out, then once we kind of understand the commonalities among patients, you have to step back and say, what else could lead to this presentation? What else could make it worse? And consider all the
Right.
possibilities, really to open it up to help others. We're not all the same, but we can start with the commonalities and then go from there.
Do you think that because you said that it's mainly in women, do you think
Mhm.
it's because genetically we're more prompt to that, or you think that psychologically we are more prompt to complain about the illness and men just, have it and they don't talk about it? What do you think it is?
Yeah, it's definitely not psychological. And I think to the uninformed, that's what it looks like, right? And about 90% of the patients we see at POTS Care are female. But my son was completely disabled by POTS. He missed 3 years of school. He developed severe osteoporosis. He broke his arms just trying to throw a ball, just putting
Oh,
on his coat. He was wasting away. His growth had stopped, and no one could help us. So men certainly can get POTS, but what looks to be the difference between men and women or is it the surge of hormones that can trigger our cycle? Are also fairly inflammatory, especially to the vascular system. And in POTS, the cardiovascular system is affected. So when we stop the cycles, it helps patients a great deal. Okay. But it's not because women are the weaker sex, certainly.
I think we are the weaker sex. To an extent, we're more vocal, even though there is
No,
this
that's not it. The men
idea that
are
we
vocal.
don't speak up, but we are more vocal when we don't feel good, and men are more tough. They're like, I'm fine, unless they got a cold, and then that's the end of the world.
That is such a good point. I will say the men we see are very vocal with it because
Mhm.
it's so much suffering and it's difficult to describe. But you get waves of symptoms where it feels like your body and even your brain is like on fire.
Oh,
Very
wow.
difficult to explain. Your heart is racing, you feel hot, you feel like your body's self-destructing, and nobody's stopping it. So, yeah, it's a terrible thing to be in. We had a gentleman patient not long ago. He had gone to the emergency room 26 times. And every time those waves hit him, and I said, we've got to stop that. We're going to start treating the underlying problem, and those will stop. But he would still go whenever it hit. And his wife took away his keys. And so he called an Uber to go to the emergency room. It is significant in both men and women. But it looks like the hormone aspect of mainly estrogen is what makes women more prone to cardiovascular effects.
Oh, wow, that is very important to know.
Yes, we're not making it up.
Important because, like, for example, right now I'm going through the postmenopause and I am on hormones. And a lot of women are hesitant to take the hormones, and a lot of them are taking the hormones. So it's good that they know that this is something that could be triggered, right?
Yes, it can be. If we look at patients as if something gets the inflammation triggered, as you say, it could be like for me, it was a virus. My son, it was a series of viruses. It can be like a car accident, trauma, what have you. Whatever gets the inflammation going isn't the cause of the illness, it's the ongoing inflammation that's problematic. And then that does damage. And you had mentioned your gallbladder. That was part of the journey I was on when I
Wow.
was considering what was going on, that some of the nerves in the parasympathetic nervous system didn't seem to be working right. They told me they wanted to remove my gallbladder because it wasn't ejecting. And I said, okay, is it filled with gallstones or is it infected? Is it going to blow like an appendix or something? They said, no, it looks normal. I said, okay.
Why are you taking my organ?
Right. Thank
Normal. That
you.
was my same
And
question, aside of the scar that I didn't like. But I was like, why? Well, because maybe you're gonna feel better after that. And I'm thinking, okay, but that is not the problem. Why are we gambling here?
thank you. Well, I said no. And I told him, I want to think this through because to me it sounded neurological. I said,
Hmm.
it sounds like that organ's just sitting there, just waiting to hear, and it's not getting a signal. And if I can figure this out, life is easier if you have a gallbladder, right?
Right.
And fortunately, I figured it out. That's part of what those patents are for, how to get that part of the nervous system working again and be able to do it from home. It's amazing. Yeah. So those clues involving the autonomic nervous system are not something doctors are really, they're not being paid to be a detective,
Hmm.
right? They're not researchers. They're there to label a condition, give the patient a medication, and send them on their way. I've been there, 8 minutes with a patient. Got to figure it out. They're not thinking of minutia in the autonomic nervous system. I can guarantee it. So for me, that's all I did was research it, dig into it, used my own body, had my little lab rat, so my kids at home to pick this apart and go deeper than anyone had ever gone with it.
So
Right.
you became your own patient.
I had to. Yes, no one else was able to help. I really tried to hang in there with the doctors because I thought, oh, they're really smart. They know what they're doing. No, they had no idea. And they could go home at 5 o'clock or whatever and not think about it. And I was living with it 24/7. And there is no way I could have exited stage left and told my kids, somebody will figure out something, hang in there. They were not even interested in really getting to the bottom of it. So it was a horrible journey to understand that they were there either, oh, sounds so bad, but there's a fair amount of money in new drugs. They were there to figure out new
Mhm.
drugs or new labels or whatever, but it wasn't to help the patient immediately.
And you said that your kids were having the illness too, but it was triggered by different things, not the same as
Yes.
you.
In
So
fact,
so it's not genetic. It's not that you pass it down, or it is.
yeah, such a good question. My husband at the time was fine. We all lived in one house. I got sick. Then, about a year and a half later, my son got a series of viruses, and each one knocked him down. He was disabled. And then my daughter started to show symptoms unrelated. She didn't appear to get triggered by a virus or whatever. We never did figure out something that kind of got her going. She was able to stay in school. My son was not, was certainly disabled. But I thought, what are the chances there's no genetic component to this? And yet my kids and I are affected.
What a coincidence,
Oh,
everybody in the house.
yeah, I have a feeling there's something genetic going on. And if ultimately we can get to the point where if POTS is not a good label, but a lot of these invisible illnesses, the labels are
Hmm.
terrible.
Hmm.
Instead, if we get an objective label based on genetics and be able to find something that gets measured in the blood that proves it, the patients will have a label that's objective and appropriate, not
Right.
the presentation, right?
Clarify that when you say presentation are the symptoms, how the illness is showing up.
Yes. And signs too, like with POTS, there's, when I say it's unofficial, it's arbitrary criteria for diagnosis. Someone decided that if the heart rate goes up 30 beats a minute or more for an adult on a table, a tilt table, then we'll call it POTS. And I
Right.
would say, okay, so if the heart rate goes up 29 beats a minute, that's not POTS. Well, that's probably POTS. I go, oh, okay. 28 beats a minute, though. That's not POTS. It's so abnormal to have your heart rate go up 28 beats a minute, right? So
Right.
instead, what we want to do is dump this arbitrary criteria with a label that's useless and
Hmm.
instead get to the point where we look for a tendency to develop a faster heart rate when we're going up, which tells us there's some sort of inflammation driving a cardiovascular response. And the sooner we locate it, the better.
So what was the first step of all the steps that you took that give you a little bit of relief?
Yes, there were layers to it. And I
Hmm.
put out a book 12 years ago called The Driscoll Theory that laid it out. The first layer was there's a propensity for patients to develop high intracranial pressure, pressure inside the skull. It was basically squeezing that brain, forcing out some of the blood flow, putting pressure on the brainstem. And when that pressure was relieved, there's medicine to do that. Hugely helpful. When that figured that out, then I thought, okay, we know as eye doctors, the reason for high intracranial pressure is always inflammatory. There's some obvious blockage of flow of cerebrospinal fluid. It's an inflammatory response. So we didn't ultimately have the answers yet, but I knew then to shift toward looking for some sort of hidden inflammation. I air quote that a little bit because most doctors learn in school that if there's inflammation, there's two blood markers to look for. One is CRP, one is sed rate. Those are
Right.
perfectly normal in the vast majority of patients. And we're told, well, it's not inflammatory. And that's just wrong. You have got
Right.
to go to much more specific chemicals to find it. Yeah. And then once that's figured out, then you have to figure out what else is that affecting besides the cardiovascular system, what else is involved, like the neurology where the gallbladder kicked in,
Right.
right? Or
That's,
didn't kick in. Yes,
well,
yes.
that's how way they went from lupus to the rheumatoid arthritis for me. It's like, oh, well, you don't have a pick right now, so you might be borderline lupus, but now we see that your levels for inflammation are high, so you have rheumatoid arthritis. It's like 2 + 2 is 4. Let's just run with the 4.
Yeah, I am so sorry. That's a very familiar journey. Most inflammatory patients we see at POTS Care present much like a lupus patient.
Right.
Heard many doctors say, okay, the testing looks negative, but it must be lupus.
That's what happened to me. I had a spike, obviously, for the
Yeah.
positive, right? So then I went back and they did another one, and the doctor said, you have all the symptoms. Your body hurts, your joint hurts, you have fatigue. I mean, all the symptoms. If you give me a checklist, I will check them all.
Yeah.
Now that we did the second test, it doesn't show us positive, but we're gonna put you borderline. So we're not gonna discard the lupus diagnosis yet, but now we're gonna give you the rheumatoid arthritis and we're gonna put you on a medication. And in 6 months, we're gonna retest you to see where your inflammation is and where your lupus is. So I'm like, okay, but in the same token, first of all, I don't like to take pills. But second of all, I'm like, what are the side effects of this medication that you're giving me? Because if the cure is going to be worse than the illness, I guess I don't want it.
You've been through that kind of journey with cancer.
Exactly.
And I can't tell you, exactly what's wrong, but I will tell you what we see at the clinic is there's a bunch of inflammatory patients who don't seem to fit into one of the slots,
Right.
right? Like lupus or RA or what have you.
Mhm.
Where I went to a couple of rheumatologists and they would say, well, you don't have rheumatoid arthritis. I go, well, I didn't really think I had that. What else could I have? And they go, well, you don't have rheumatoid arthritis. It's like this broken record. You can only
Right.
have one thing. But I did find even when I was extraordinarily inflamed, and even when an MRI picked that up very clearly, pathologists didn't know what to do with it. And one said, well, without a label, I can't really help you. I know you can't give it a whirl. You can see the inflammation. I'm dying here. Can you
Right.
just try something? No,
Right.
I'm sorry. Can't do it. Incredibly frustrating. But I think someday we will have many more labels for a lot of those chronic inflammatory conditions.
I noticed that in the questionnaire that you did for the show, you wrote that the chronic dry eye and the vagus nerve disorder, are those related to your illness, or you found all these things because you were looking for answers?
Yes, well, again, it evolved over time. But when I was looking at what started out as me, my symptoms, I tried to cluster them. And one cluster was these were vagus nerve symptoms. The vagus
Mhm.
nerve controls the breathing, heart rate, most every aspect of digestion, including the gallbladder, motility, bowel movements, etc. And all of that was broken. And I remember thinking, could that nerve be damaged somehow? That would make sense to me. I was considering options for that. But then I thought, we don't know that. Could it be a bigger problem? Could
Right.
it be a problem with the neurotransmitter, the chemical
Hmm.
needed by the vagus nerve, and that chemical is needed by other systems of the body? 5 years, I reached out to patients diagnosed with chronic fatigue syndrome, POTS, fibromyalgia, and PTSD. The majority of those patients had the majority of symptoms of low neurotransmitter. That this is a bigger problem than just a vagus nerve problem. So then I set about trying to trigger that nerve by using the receptors. Worked
Hmm.
great. And then ultimately came up with a supplement, an over-the-counter pill called Parasim Plus. It goes right for the receptor, restores the nerve function immediately. The tear production went up, pupils would go down, cognition improved, and knew that was another huge layer to the condition, right?
I find it so brilliant from you're so smart because you're a doctor for the eyes. It has nothing to do with the rest of the body, but you got curious and
Yes,
you didn't run with this the first answer or the first diagnosis. You went deeper and trying to find out, okay, yeah, my eyes, I'm having these symptoms, but then also it's my body and there's also my circulation, it's also my heart.
right.
Let's put all this together instead of isolating them and find out what it is that is causing me to feel this way. And
That's
by
exactly
you
right.
being your own patient, you were able to target certain things that a doctor wouldn't be able to target because they're not feeling what you're feeling.
That's exactly right.
You can be at home and suddenly you have a needle pain in your brain, and then you're gonna go next week or in a month to the doctor and say, "Oh yeah, I had a needle pain." But when you felt that needle pain, you also could notice what else is happening in your body together with that needle pain. So then you are like changing hats. I'm a patient now, I'm a doctor now. So let me see how me wearing the hat of the doctor can help me wearing the hat of the patient.
That's exactly right. And I had plenty of failures, but I approached it as I am more sensitive to changes in my body than anyone else, right? And I'm willing to try some things. I'm willing to fail some. I just don't want to do anything so stupid that it kills me. So I tried to avoid as many invasive procedures as possible. Every surgery known to man was suggested to me, everything from neck fusion to gallbladder, brain shunts, all kinds of things. I ended up not needing any of them, that it was controllable with low risk medication. It just had to be figured out. So extraordinarily frustrating, rewarding,
I was gonna
to
say
help
that.
others. Yes, yes. And to know like my kids are fine and will remain fine had we not gone through that. I shudder to think.
Now you're able to help a lot of other people. I can
Absolutely.
imagine. I mean, as moms, we deal with whatever, but when that is affecting our kids, that's a whole different ball game because now you really have a purpose. You're really gonna be in a mission to find out what this is because I don't want ever my kids to feel what I am feeling right now.
And they did. My son came to me. He got sick when he was 8 years old, and we tried to keep him in school for a year. It just failed miserably. And he was suffering so much. And he came to me when he was 9 years old, Claudia. He said, Mom, you have to understand, I can't keep doing this. I can't go one more day. And at that point, I had no answers at all and tried to be strong and kind of got on his level and looked him right in the eye and said, I know you're suffering. I know it's bad. And
Mm.
I'm not going to give up figuring this out. We're
Wow.
going to figure it out. We're going to get better. And it gave him peace to keep going. But I knew the level of suffering he was going through was significant.
I think it's so important as a patient to feel seen
Yes.
and not dismiss. And now you're gonna get better. I know what you feel. I feel the same way, but you're gonna get better. Don't worry about it. No, it's the level of empathy that you gotta have, and I'm sure you have with your patient, but not patients, but now it's your son. Now is you telling him, I know you're in pain because I'm feeling the same pain. Not that my pain is bigger or less or smaller, but I'm here with you.
Yes, absolutely. You have to validate what someone's going through first
Yeah.
and then take the next step. But it's also the empathy and passion I feel never goes away because that journey was so long for us. I was disabled for 10 years. The
Wow.
suffering was so great. So anytime I talk to a patient, it takes me right back to those
Right.
times.
That affected your life, your work, your marriage,
Every,
your relationships, everything. Because
every,
if you are not going through that, it's very hard to understand what you're going through.
yes, it did. It affected everything.
Did
So.
you have to change your diet?
That's an interesting question. Initially, when I was first diagnosed, the doctors would say, well, you should eat well, exercise. And it's like, I was already there. Nutrition was a hobby of mine. I was an excellent eater. I taught aerobics classes. Exercise was always very important. I was in great shape. So I went into the illness already at a great level on nutrition and exercise. I said, there's nothing to change. Okay. So increasing exercise or changing my diet isn't necessary. That's not why I got sick.
Right.
I said that as I got sicker and then the digestion was affected, I got horrible constipation punctuated by diarrhea. And then I ended up with complete gastroparesis. Nothing would move at all. Waves of nausea. There was never a normal bowel movement. Yeah. Okay. Then you eat anything you feel like you can keep down.
Go from one extreme to another extreme. It's like you're diagnosing me because I have days that I'm fine and then I have days that I eat something that somehow trigger me and I end up in the floor. Like in
Yeah.
the floor, sweating, sick. And
Yes.
my daughters ate the same thing or my husband ate the same thing, but did not affect them the way it affected
Yeah.
me.
Yeah, that's kind of a clue, right? That's
Mhm.
kind of a clue. So there's a reason for it. And when that's figured out, you have a chance of getting a correct treatment protocol. I would be less concerned with these sloppy labels where you don't
Mhm.
exactly fit in. Try to avoid a label if you can. Instead, pick apart what exactly just happened and what are
Right.
the consequences of it. But I always encourage patients to do the best they can with their nutrition and eating, but that's not why they got sick. Transfers blame for this illness onto the patient, which is just not fair. They did nothing usually to cause their illness.
Right.
the genetic predisposition for some forms of inflammation. It is what it is. But as they feel better, as their digestion normalizes, their ability to tolerate foods, etc., then absolutely steer toward nutrition, avoiding processed foods, kind of the standard stuff.
Mm-hmm.
It helps. Absolutely helps. Yeah.
Wow. And you touch something that is so important, right? The guilt that one patient feels. It's like, I don't want to be a bother or a burden for anyone. So they keep it to themselves oftentimes because they don't want to make everybody tired around them because they're complaining so much. So that guilt, I mean, I feel it. I have felt it. Like, I'm not going to say it. My husband sometimes says, how do you feel? Do you have any pain or whatever? And I go, I never not have pain. I just don't complain because you get tired of listening to yourself being a broken record, right? So and it's important to acknowledge that because there is a lot of patients that probably are listening to us that feel identified and validated that we see you. We know it's hard. We know it's difficult. So, what things do you think somebody that is listening that has some of the things that you have mentioned, what things they should be really paying attention to?
And which is complex since even the patients we see at POTS Care are all different. I think there's a page on the website on POTS Care called Inflammatory POTS. If someone's heart rate tends to increase when they stand, and frankly, Claudia, it'd be interesting to see if yours did, they can kind of start there and see what have their doctors ruled out as far as
Okay.
inflammation goes. Like what you're learning is I'd be very cautious to accept a label if the testing is negative.
Right.
Okay. I had to just take the labels that I was given and say, until these are proven, I'm throwing them away. Right.
Right. Don't claim them, don't
Exactly.
own them. I was
Mhm.
talking to somebody the other day and she said to me, because my lupus, and I said, why are you claiming that? Don't
Good for
claim it.
you. We see Ehlers-Danlos syndromes, until we know what that is genetically, don't label yourself with that. Mast cell activation syndrome, I see that a lot, where the testing is negative, much
Mhm.
like rheumatoid arthritis testing, it's negative, but maybe it is. So don't accept any of those labels and don't give up. With POTS, we can lay out more steps to kind of explore, and much of that is in the Driscoll theory. And I have a Patreon account called POTS Rebels where we
Mhm.
put everything. There's a ton of information in there. So if someone's dealing with POTS, that's a great place to go. And I meet with them a couple times a month and answer questions and validate them and that sort of
Right.
thing. And I think in 10, maybe 20 years, it will be completely changed. The label won't be POTS. A lot of
Mhm.
these chronic inflammatory conditions will have the correct
Mhm.
labels, hopefully with genetics tied in.
Right.
And patients won't have the battle that they have right now that should not be happening. And I'm here to do everything I can to speed up that process. Yeah.
And don't take just the you are okay, don't there is nothing to worry about as a final diagnosis if you don't feel well.
I was not even close to accepting it. I couldn't work. I
Mm.
couldn't stand up usually. My son sometimes he couldn't even sit up without fainting. So it's not like we could just push through. We were tired. It was so much more dramatic than that. And initially it would have windows of normalcy. It would go up and down. There'd be a little window of normalcy. But
Mhm.
about 3.5 years into it, those windows were gone. And then ultimately I was bedridden, as was my son. So this wasn't clearly, it wasn't a psychological condition, although we did exhibit to the
Right.
uninformed.
To an extent, it mess up your head, you know? How long can you not feel well?
Well, it was so much more than that. The inflammation ultimately affected the brain.
Right.
That also across the board with our patients, anxiety symptoms go up. And
Mhm.
interestingly, some of the symptoms of anxiety can exhibit like almost an OCD, attention to detail. We're very high achievers. We're like at the top percent of everything we do. We like things done a certain way. It can get to the point where it's crippling. We can't live with people. Expect other people have the same bar of excellence that we do, and they just don't. We can't even feel comfortable in our own brain ultimately. But that was the changes to the brain due to the inflammation and the secondary oxidation.
And I want to bring something up that, as you said, your child had it at 8 years old and you were an adult, so there is no age.
Right.
sometimes we dismiss the kids when they come, I have this, I have that, and you're going to be okay because we assume that because they're children, they're supposed to be healthier because they're younger. And this is a great opportunity to pay attention or notice if your kid, God forbid, is showing those symptoms and then dig in, get curious.
Yes, initially, if I had been like 20 years old or my son was 20 years old, we
Hmm.
would have been told, in fact, they tried to tell us this anyway, oh, you'll probably outgrow it. Okay, I'm 46 years old. I got sick. So I'm not going to be outgrowing anything. My son's
Right.
8. Is he supposed to suffer for 10 years in the hope that he'll outgrow it? Everything seems so ridiculous to me. The approach that being told give it 2 to 5 years to return to the daily activities of living. I said, what does that mean? In 5 years, I'll be able to dress myself? You got to be kidding. What just happened? How did this happen? And if we figure that out, could I go back to what I was before this virus?
Right.
Could my son return to normalcy, start growing again? The answer was yes, but we had to figure it out ourselves, which is a crazy position to be in.
Did that affected his growth as far as being the right height for his right age?
Well, he's 6'3", so he says it's thank goodness my growth stopped. So he did grow again.
Mhm.
But yeah, he was so fragile. He looked like he was a cancer victim. He was a
Oh.
skeleton ultimately with severe osteoporosis. So it took him some time. Ultimately, when he went on to college, he said,
Mhm.
I'm healthy now. No one remembers, nobody knows I was sick like that, right?
Mhm.
I have a chance at a new life. So at that point, he just started his life over, basically.
And is he on medication so it doesn't come back?
No, but he knows. I don't think or maybe once in a blue moon he'll need something, but I don't think so, at least not much. We're very aware of the supplements I've released because of the
Mm-hmm.
patent, and
Mm-hmm.
he's very aware of those. But what we look for is any sign that the inflammation gets triggered, because if it does, we want to jump on some things.
Right.
That
So that's
doesn't.
pretty much how it is. It's not that he grew out of the illness, it's that
Right.
you able to control it in a way that he can have a normal life now with the supplements that he takes every day.
He doesn't really take much, if anything, anymore. For a few years, he had to very regularly take things which controlled the inflammation and the effects of it well enough that his body could heal.
Okay.
Yeah. So the ultimate goal at POTS Care is always complete recovery, complete
Okay.
resolution of POTS. But whatever got the patient to that point, we need to know that. And then
Hmm.
the question is, what is the minimum amount of any help they would need to maintain their health and not worry that this is ever going to happen again?
And what
Right.
about you? Because he was in the process of growing, but you were already an adult. Do you
Yeah.
have to continue a treatment or you are also like him, fine and healthy and you don't need to take anything?
And I think I'm probably a good example for most that the longer we're sick, the more damage that tends to be done, the more it takes to stay healthy.
Hmm.
But now I haven't had POTS for, I don't know, a dozen years. I don't ever plan to have that again. I'm not a sick person. I'm
Hmm.
probably the most active person I know of any age. But I am very proactive, and it's not treating an
Hmm.
illness at this point. What I walked away from in going through that illness is what I learned about correcting the damage done in the cardiovascular system, the GI tract, etc. Could we use that information going forward as I get older to be healthier than my peers? Could we
Right.
avoid some of these old age illnesses? This chronic inflammation as we age increases. It's called inflammaging. With what I learned on how to control that, could I maintain healthier levels of inflammation going into old age? And would that make me healthier, happier, smarter, less likely to develop neurodegenerative,
Hmm.
cardiovascular complications, etc.? And I would say so far the answer is yes. So, so I am
Wow.
very proactive, but it's not treating anything. It's
Right.
more to maintain the best health possible. Brain, eyes, you mentioned like dry eyes,
Mm.
vascular health, very important to me. Yeah.
Yeah, and that is great that you said that because yes, as we get old, we start having those symptoms, right? The rheumatoid arthritis is very common when you're in your 60s or your 70s. You develop those things, but if you have like a preventive lifestyle, then you
Yeah.
can also avoid that.
And when we measure some of these inflammatory chemicals more routinely, I
Hmm.
think it won't just be me jumping up and down saying as we age, we should keep the level of these inflammatory chemicals down. There are
Right,
some things in our control to do that. And if we
right,
do that, will patients age better? Can we get rid of some of these long-term old age illnesses? I strongly believe yes. We should be more proactive. And the 10 years of suffering that I went through, it really felt like dying. It felt like the last 10 years of someone age 100 or something where everything's falling apart. I don't ever want to go through that again. If I can
right.
do anything to avoid that, staying strong and healthy and being proactive is really the way I live. I don't want to go
Wow.
backwards.
What
Yeah.
a journey you had. It's so inspiring for so many people that just receive an answer or that diagnosis and then they just go with that. I'm so happy to have this opportunity to speak to you because if there is somebody listening that has had no answers, now they can reach out. Where can they find you?
I'm at potscare.com.
Mm-hmm.
Yes. And a few other places all over the place. But that's probably a decent place to find me. I have drdianadriscoll.com where I try to house everything. And the Patreon account, Pots Rebels, has been a great place to put information too. Yeah.
Okay.
And I talk to patients all over the world. And most patients who talk to me, they'll say, well, in our country, we're just a wasteland for help in this condition. And no, that's pretty much everywhere. That's
Right.
everywhere. Yes. So this is not a problem that's specific to the US or what have you. It's everywhere that patients are scrambling for help, which breaks my heart.
And also brings light to it's not environmental. It can happen anywhere.
Yes, and I'm so glad you mentioned that. And our inflamed patients get more and more sensitive to the environment. When we control the inflammation, their sensitivities can go away. We have to be very careful that the trigger or whatever sensitivities they have can improve or go away, but the propensity to the inflammation needs to be focused upon throughout life.
Right. Amazing. Thank you so much
Thank
for
you.
being
I really
here.
appreciate the opportunity to
I
meet.
have learned so much. I'm going to get curious and I'm going to have all your links in the description of the show. Also, I want to remind my audience if they want to receive the newsletter when the episode is uploaded. I talk about in my newsletter. I have again all the links and all the information that takes away from the episode. So it's another resource for them. So then you will get a copy as well when it's uploaded with all the links. So you can repurpose the episode if you want to, or use it for your patients or anybody that wants to learn a little more about it.
That's wonderful. Thank you. We'll absolutely share that. Appreciate it.
Thank you. Thank you all for listening to the Don't Shrink to Fit podcast. If you like this episode, please write a juicy comment below and subscribe to my podcast. Remember, we can only fly if we embrace each other. Until next week, be happy, be safe, and be kind to yourself.